You can provide hand therapy for your patients in a skilled nursing facility, and I'm going to share with you how. My name is Wong. I'm an occupational therapist and certified hand therapist, and I love to help therapists develop their clinical skills in hand therapy. Now, most therapists think, oh, I'm not a hand therapist, so, I can't do X, Y, and Z. Or, oh, I work in a skilled nursing facility, so I'm not a hand therapist, so I can't do X, Y, and Z. But here's the problem, is that you're thinking about hand therapy in a very traditional setting, meaning like an outpatient setting, meaning like I work with flexor tendons and I work with post-surgical cases and everyone has a broken finger. I get it. Most people think of hand therapy in that setting, but I want to encourage you to think of hand therapy as like a bigger, broader picture, because no matter what setting you're working in, especially in a skilled nursing facility, those patients, the people in those settings really need therapists like yourself who have an interest in hand therapy, and you really can get really great working with those people and really helping them. So if we think about most of our patients have two hands and two arms if they're lucky, right? And as occupational therapists, we have a tendency to be kind of like pigeonhole, box into like we treat a lot of upper extremity cases. Hence, majority of hand therapists, certified hand therapists are occupational therapists. So think of yourself as an occupational therapist. Think of yourself as someone who has the skills to work with hand and arm injuries. You don't have to label yourself as a hand therapist, but I want to share with you how you can potentially do that, because I think where therapists tend to limit themselves is like, oh, I work in this setting, so I don't know how to do X, Y, and Z. And I want to open your mind to that, because you're working with these people who have two hands and two arms. And what are some of the diagnoses that are in a skilled nursing facility, right? So I worked in a skilled nursing facility. I worked with people who had strokes. I worked with people who had general weakness, right? General decline in function. Decline in function. Because they were sick and they had pneumonia, they have a congestive heart failure, they have kidney stuff, and then they sat in the hospital for too long and now they couldn't do their ADLs, right? They maybe had an orthopedic issue like a fracture, a joint replacement. I mean, you can name it. They're in there because they cannot go home to be able to take care of themselves. They cannot go home because these are essentially the diagnoses, but here are their symptoms. Symptoms. Oh, I can't spell, right? Well, maybe not their symptoms, but their general, the reason why they're there. People might have too much pain. People might have a decrease in ADLs, decrease in functional mobility, right? Due to whatever they had. But all of these people, pain, reduced ADLs, decreased functional mobility. In order to use your walker, because you can't move around, those people overuse their arms and end up with what? Thumb pain, wrist pain, elbow pain, shoulder pain, right? The people who cannot do their ADLs can't raise their arm, can't, do fine motor, do buttons, because maybe they have a history. So think about all the people who come in with all these diagnoses. They have a history of different types of problems. They might have a history of arthritis. They might have thumb arthritis. I mean, you are literally in the playground of hand therapy. It's just your patient population might be a little bit older than when you work in a hand therapy clinic with fractures and surgeries. You're gonna see a lot of different ages, most of them being, adults, more or less. In a skilled nursing facility, you might be working with older adults and geriatric adults, meaning they're much older, right? But all these people have 2 hands and 2 arms, and they need occupational therapists that can and will do joint mobilizations, some manual therapy techniques to help them reduce their pain wherever it is, because in a skilled nursing facility, they're not telling you only work on that thumb, only work on, the tendonitis. Like in an outpatient, in a traditional outpatient setting, you might be bound by insurance to say you're only working on this body part. In a skilled nursing facility, you have to work with that overall picture, that overall function and goal. The goal being that they go home, right? Go home. If they're lucky, they get to go home. Some people have to stay long-term in a long-term care facility, but that doesn't necessarily mean that they can't do better, feel better. And so as an occupational therapist in a skilled nursing facility, you can provide some hand therapy. Let me show you what that might look like. This is the shit that I wish I had when I worked in a skilled nursing facility, right? Instead of saying, oh, like hand therapists are, over there and then I'm over here, like we're all together. So let's say you have someone with thumb pain, someone with CMC arthritis, right? So, older people, they might have arthritis everywhere. They might have arthritis specifically at their CMC joint, right? And so the expectation, right, if you're in a traditional outpatient clinic, you might see a CMC, someone with thumb pain trying to avoid surgery, or you might be working in a surgeon's office and seeing someone just had a thumb joint replacement or blah blah blah. All right, it doesn't even matter. Your patient in a skilled nursing facility might have thumb pain, but they have a history of arthritis. So it's not that you can't help them, it's your expectations of how much you're going to get is going to be different, right? If I'm working with someone who's 40, I want full freaking range of motion. I want no pain. I want return to full function. If I'm working with someone who's been living with this for 40 years and they're 80 years old, I'm gonna have a mildly different expectation, right? What am I gonna do? I'm gonna help you I'm gonna do some, if you have arthritis, I might do some joint distraction, right? So but I have to know like the structures, right? So, and the hand placement of how I could do it and what I'm looking for to help get this person some relief, right? It's not that you're going to cure them and fix them of all of their ailments at 80 or 90, but man, wouldn't it feel really good for you to help them just for a little bit, even if it doesn't like last? Wouldn't it still be nice? Listen, if I was 80, I would love for someone to give me some love and care like that, right? So you could do some joint distraction. You might be able to lift their joint and put that in place. Wouldn't that feel really amazing? You might do some soft tissue massage, some trigger point, trigger point massage or whatever. Blanking on the word, sorry. And then you might work on some functional range of motion to open their hand. The thumb is not hard to close, it's hard to open. So you might work on opening your thumb, because why? When you work on opening your thumb, they might be able to grab their clothes from the closet better, grip their walker so they can walk better with less pain in their thumb, right? They might be able to do their buttons, pull up their pants with less pain, right? So from a functional standpoint, that could be your goal, because you're gonna help them to do their ADLs. You're gonna help them to do their upper body dressing, their lower body dressing with better thumb, and hand function more independently with less pain. That's a freaking goal right there, right? So from a hand therapy perspective, do not rule yourself out. as providing hand therapy in a skilled nursing facility. My father-in-law had a stroke, and let me tell you, as someone with a stroke in a skilled nursing facility or in an acute rehab setting, I'm gonna, kind of very similar settings, right? One is faster, one's a little slower, right? So, but, the diagnosis is of a stroke. You could be working on the shoulder, like you could be like working on that shoulder, instead of just doing like freaking table slides and I don't know, I don't want to say bullshit, because there is a purpose to some of them, but he would have done really well if somebody got in there, moved his scapula around a little bit, ranged his joint a little bit, worked on the tissue a little bit, and then got him to actively move that arm because he had some movement, right? If someone could have ranged his stiff ass fingers so that would fit in the splint, right? Oh, don't even get me started on the splint, right? Know what splint to recommend, now how to put it on. That is hand therapy. But you don't have to limit yourself to only being in a very traditional hand therapy setting to develop your clinical skills, to practice your clinical skills, because it's in settings like these that you can learn and you can practice on these people who would give you all the time and attention in the day, to practice those skills. And then if and when you want to move into a more traditional outpatient hand therapy setting, you're gonna be able to show up in an interview and say you know how to do some of this stuff, even if it's for older people, right? And it starts with the interest in developing your skills. There's different classes, different courses to take. If you were to ask me, like, Huang, which course would be really good for me to get started with, right? I would say in a skilled nursing facility, some people just jump right into like, I want to become a certified hand therapist, so I want to take your CHT class. But that sounds so overwhelming to you. You're like, you can't even wrap your head around it, so you do nothing, right? I'm encouraging you to do something so that you can eventually get there if that's something you want. Foundations of Hand Therapy is a phenomenal class to get you started. If you don't have outpatient therapy experience at all, this is a really great class for you because it goes over how you would evaluate in an outpatient setting, the clinical testing, give you examples of, very common hand injuries that you could start to treat, right? How to document. And so that's for someone who's, like they really want to get that job in hand therapy. You would take that and then you would start, like, learn, apply for those classes, apply for those classes, not classes, for those jobs, right? I think the manual therapy on demand, like you can take a live class or you can just get it on demand now that it's available. But that allows you to take a lot of the techniques that I'm teaching in that. And here's the reason why I think that on demand is actually really great for someone who is working in a skilled nursing facility. The reason why I think it's really great for someone who's working in a skilled nursing facility is because you have access to these videos like your lifetime, right? So you can take your time to learn and take your time to practice on your patients. So for example, if I'm showing you a thumb, you're gonna go and you're gonna learn about the anatomy, you're gonna learn the techniques, the thumb techniques, and then you can go and you can try it on your patient with thumb pain. You can try it on your patient with a stroke. You can try it on your patient who's functionally declining, but they have had a history of thumb pain for a really long time and has always bothered them and they haven't been able to do X, Y, and Z. You now can work on some of that and you can take your time to practice with all these people. And in a skilled nursing facility, those people need so much time and attention that they are very nice and very forgiving. They won't know. they won't know if you're not doing it right? They're not going to be nasty to you. If you came into a traditional outpatient setting and you went right into working with someone who's post-surgical and you have absolutely no skills, I mean, first of all, you feel like shit because you're completely overwhelmed. You don't know what you're doing. So you feel like you shouldn't do anything because you're afraid to mess up, right? In a skilled nursing facility, you really can't mess up. These people, like, oh my God, if you just gave them some love and attention, like when I worked in a skilled nursing facility and I was doing manual therapy because I don't know, I just really loved it. Can't remember why, but I would do stuff with them and they would be like, oh my God, Huang, your hands are so great. That's so awesome. Like, you can't go wrong there. You just can't go wrong. So when people tell me like, oh, I'm not a hand therapist, I work in a skilled nursing facility, stop saying that. Stop saying that. You could totally provide hand therapy in a skilled nursing facility and keep developing those skills, work on developing those skills. And then when you don't want to be in that setting anymore, you can move on into a different setting. I've known certified hand therapists who've worked out of there, became certified hand therapists, and for whatever reason, go back into a skilled nursing facility to work, whether it be per diem or full-time for whatever their life phase is, and they know how to take those skills and apply it in all different types of settings. So my whole point of this video is to encourage you to think outside of the box and don't pigeonhole yourself. You're the only one pigeonholing yourself. So open up your mind and think about what clinical skills you want to develop. The links are all there for you whenever you need and whenever you're ready.